Hello everyone, welcome to Radiology cases tutorial. Today we are going to discuss the hepatic malignant tumors in the different patients. In this topic we will discuss the metastasis, hepatocellular carcinoma and lymphoma. Let's start now. First of all, we learn about the sonographic features of the metastasis. The lungs and the liver are the most frequent sites of the distant metastatic disease, and the majority of the metastatic lesions have the target appearance with an echogenic or the isoechoic center and a hypoechoic halo. Thin halos represent the dilated peritumoral sinusoids or the compressed liver parenchyma, whereas the thick halos represent the proliferating tumor. After the metastasis, the most common cause of the target lesion is hepatocellular carcinoma. Now, this is the case of hepatic metastasis. This is the target lesion that is scanned to the hepatic metastasis, and this picture shows a central aspect of the tumor that is hypoechoic, and its outer rim is hypoechoic and it's very thick. Now, in this case, the multiple echogenic foci are seen here and shows the hypoechoic rim here. Now, this is another case that shows the two metastatic lesions that are isoechoic to the liver parenchyma and shows a thin hypoechoic halo. Now, this is a case that shows the hyperechoic multiple metastatic lesions with the hypoechoic thin rim, and this is a large lesion that is almost hyperechoic, but its rim is thin and hypoechoic. That was the property of the metastasis. Now, this is a case that simulates the hemangioma, but it is different from the hemangioma as it has a thin hypoechoic halo that differentiates it from the hemangioma, and it is the hepatic metastasis. Now, here shows the liver metastasis with the variety of the sonographic features in the different patients. Now, these are the two adjacent metastases that arise from the colon cancer with a solid homogeneous hypoechoic appearance and a slight increase in the through transmission that looks like the acoustic enhancement. And here we can see the multiple solid hypoechoic lesions that are originated from the primary breast cancer. Now, this is a case that looks like hemangioma. It is solid hyperechoic lesion that is simulating the hemangioma, but it's originating from a primary rectal cancer. And this is another case that shows the multiple solid hyperechoic masses that are similar to the hemangiomas but originating from the primary osteosarcoma. Now, here we can see the solid mass that has the diffused stipples calcifications originating from a primary prostate cancer, but this is the solid predominantly hypoechoic mass with central shadowing echogenic region due to the calcification, and its primary tumor was the colon cancer. This is another case of metastasis, another patient that shows the slightly hyperechoic lesion with peripheral hypoechoic halo and the central area of the liquefaction from the primary lung cancer. And this is a large cystic mass with a low level internal echoes and a thick hyperechoic wall that is replacing most of the right hemiliver, and its primary tumor was leiomyosarcoma. In the diffuse hepatic metastasis, the liver may appear diffusely heterogeneous and it may become difficult to identify the individual lesion. Here the diffused hepatic metastasis in the two different patients. This is a transverse view that shows the diffuse heterogeneity of the liver with multiple confluent target lesions. And this is a standard view of the liver that shows the mild heterogeneity of the hepatic parenchyma. It is difficult to define the individual lesions on this image. Now, we are going to discuss the hepatocellular carcinoma. What may be the sonographic features of the hepatocellular carcinoma? The most common primary malignancy is the hepatocellular carcinoma, and the growth pattern of the hepatocellular carcinoma is quite variable. It may be solitary, multifocal, or the diffuse and infiltrating. The echogenicity is also variable, and in general the sonographic appearance is non-specific. One pattern that is typical of hepatocellular carcinoma is a large dominant lesion with scattered smaller satellite lesions. Now, this is the case of hepatocellular carcinoma in the different patients. The standard view of the liver shows a solid, homogeneous hypoechoic lesion and a diffusely nodular liver parenchyma. Now, this is another hepatocellular carcinoma lesion that is slightly hyperechoic, that shows a target lesion, and it has echogenic area inside and shows a hypoechoic rim. Now, this is a solid hyperechoic lesion and a diffusely nodular liver. Now, this is the predominantly hyperechoic lesion and found to have a fatty components. Here we can see the mixed echogenicity lesion with well-defined hyperechoic center and the well-defined hypoechoic periphery, and this is the large predominantly hyperechoic lesion with the smaller scattered cystic liquefied spaces. This is another case which is a large hyperechoic lesion replacing the most of the liver parenchyma of the right lobe of liver. The large lesions such as this are often difficult to detect the sonographically, and this is the diffusely infiltrating tumor that is entirely replacing the visualized portion of the liver and resulting in a diffusely heterogeneous multinodular appearance, and this lesion was not recognized sonographically but later was confirmed on the magnetic resonance imaging. Hepatic cellular carcinoma shows a high vascularity, but this is not always correct. The color Doppler view shows here the multiple centripetal vessels entering the mass from the periphery, and this is the power Doppler view that shows the cortic vascularity and the large mass. HCC has a strong tendency to invade the hepatic vasculature. Estimates of the venous invasion range as high as 30% to 60% of the portal veins and 15% for the hepatic veins. The obstruction of the bile ducts is uncommon and is usually due to the extrinsic compressions. Now, this is a transfer sonogram that shows a solid mass with invasion into the adjacent portal vein. Now, this is the longitudinal view that shows a large solid hyperechoic mass with direct invasion of the adjacent hepatic vein. Also here shows a small hypoechoic satellite lesion. Now we are going to discuss another hepatic malignant tumor, that is the lymphoma. On sonography, it usually simulates the metastatic disease, typically appearing as the target lesion or as a homogeneous hypoechoic mass that looks like a metastasis. Unlike the metastatic disease, it is very unusual for the lymphoma to appear hyperechoic, to contain the cystic spaces, or to contain the calcification. Because lymphoma is very homogeneous tumor, that's why it is typically hypoechoic, and it may have detectable posterior enhancement, although this is less than the expected for a cyst of a similar size, so it can be simulated with a cyst. Lymphoma in the different patients, here we can see this is the multiple homogeneous hypoechoic solid liver lesions, and this is the classic target lesions that looks like a metastasis that has a echogenic area inside and a hypoechoic halo. Now, this is a standard view in a patient with diffuse involvement that shows heterogeneity and coursing of the hepatic parenchyma, and this pattern can simulate the cirrhosis. And here we can see a solid hypoechoic mass that shows the moderate acoustic enhancement. Thanks for watching. Like and subscribe our channel for further radiological interesting cases.